Welcome to the first day of our iCON Health Forum. Um, our theme for this week is going to be Take Charge of Your Health, Dementia 360. Please click on preview if you want to join the forum.
So we would like to acknowledge our iCON office is situated on the traditional ancestral unceded territory of the Musqueam, Swamish, and Skallequt peoples. I would also like to acknowledge that you are joining us today from many places near and far and acknowledge the traditional owners and caretakers of those lands. And there are a few announcements. First,
thank you very much. Thank you. I think that on screen you can, some of the participants have done this before, have joined our activities before, and today I'm just going to make a simple introduction of what iCON is all about. Hopefully that some of the participants will know. So the iCON is one of the projects initiated by the Digital Emergency Medicine of the Faculty of Medicine at the University of British Columbia. The main purpose is to help people in multicultural communities, including Chinese communities, understand how to prevent and self-manage chronic diseases by organizing health seminars, workshops, and using internet technology. We strive to share the most accurate and reliable health information with you. Not only do we hope that local people will actively participate in seminars and other activities, we also hope that the sharing of this health information can be extended to more remote areas and overseas through live webcasts and help everyone work together to improve their health. All right. First of all, I want to introduce from the lead of digital medicine, emergency medicine, and the founder of iCON, Dr. Kendall Ho, to give you a warm welcome. Kendall. All right, Barbara, thank you. Well, everyone, our friends online and the Cafe Nursing Home and the Mineral Community Center, we thank you for your active participation. I am Kendall Ho. I am at UBC. I am one of the professors at the School of Medicine at UBC, and I'm also the executive director of iCON. On behalf of the university and on behalf of the Ministry of Health, I thank you for your participation. And I know that it's been for 2 years that we've had this pandemic, so it's affecting us to the point where we have to do this online. I hope that in the near future we can sit together and then we can actively participate and know each other and know more information. And I know that today we thank you for your active and your enthusiastic support online, and then we can meet on the air. I know that there are some good friends, old friends, and there are also some newcomers, and thank you for your participation. I hope that today, this subject on the talk of dementia, we can get some insights into this issue. We also thank many media partners. They help to promote this forum, and they're also exhibitors, health exhibitors, like Barbara said just now. Those you can visit within the next month. So every time after we have spoken, we will introduce 1 or 2 exhibitors to you. And we also are very thankful for the community partners. Today, I'm not able to thank them all, so I'm not going to thank them one by one. I'm very happy that at this point in time, I know that there are many speakers who will share with us their information, and I'm not going to delay that process. But before they do that, I am very honored to be able to invite the representative from the Ministry of Health in BC as Lindsay R. Scott.
I would like to invite Ms. Lindsay R. Scott, who is the Director of Primary Care Quality and Primary Care Division of BC Ministry of Health. It's a huge pleasure to have her here join us today, and very kind to have her present to us opening remarks. So Lindsay, I'd love to pass this over to you, and thank you so much for being here.
Thank you, Kendall. Thank you for the opportunity to provide opening remarks at today's Chinese Health Forum, Take Charge of Your Health, Dementia 360. I'm Lindsay R. Scott, as Kendall said, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health. I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I'm located on in Saanich, and to the Songhees, the Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I would also like to acknowledge the Métis Charter community located in Victoria. Patients as Partners is based on the motto of nothing about me without me. We believe that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but is an effective way to make the health system better and the people of BC healthier. Patients as Partners has collaborated and funded iCON for over 10 years with Dr. Kendall Ho as the executive director for all of that time. When iCON started, they brought hundreds of people together to learn about managing chronic diseases. And over the years, iCON has continued to bring healthcare providers to speak to people in their first languages about topics people want to learn more about. This health forum brings together a number of presenters whose aims are to increase understanding of what dementia is and how to recognize it. Importantly, they will provide resources and strategies that you and your family can use to empower and optimize your quality of life. For me, today's topic is particularly important as my grandfather suffered from dementia. Having access to today's information and resources could have increased not only his quality of life, but my family's. I want to thank iCON for bringing us together today for this discussion, and I invite you to check out their resources after the discussion. Also, take a look at our patientsaspartners.ca website for other resources and more free educational events for patients and families. Again, I want to express a big thank you to our presenters today, and I appreciate your time and look forward to learning more. Thank you.
Great. Thank you so much, Lindsay.
Thank you again, Lindsay, for this opening remark and your support. And now I will pass the mic back to Barbara, and our forum starts now. Thank you, Dr. Today, our theme is about managing health, Dementia 360. So you can tell that we hope that we can offer a series of topics on this theme to give you more insight into this issue. And there are so many things that we're going to cover today and tomorrow. For today, we want to recognize what dementia is and what the symptoms are and how the importance of early detection and when you will need to seek help and how to treat them, how to treat it, what are the medications to treat it, and how to how to interact with patients with dementia. And for tomorrow, there is another part of this. We're going to talk about nutrition for dementia patients and their mental health, as well as their home safety, as well as their long-term care. So when the patient will need to go into long-term care and also other care aspects, which we will leave for tomorrow.
I'm going to introduce Dr. Wong. Actually, he doesn't have to be introduced because he's very famous. So he is going to explain to us the diagnostic process and the treatment and the treatment options. So I'm passing it to Dr. Wong. Okay, thank you, Dr. Wong.
Thank you, Dr. Ho. How are you, everyone? I'm very honored to be here to participate in this forum, this iCON Health Forum, from the Faculty of Medicine at UBC, and we hope that we can work together and with after this talk. So Dr. Ma has explained in detail what is dementia, and I'm going to pick up on that and tell you about the assessments and treatments for dementia. Actually, you can tell by the name that it's about cognitive impairment. You've heard about Alzheimer's disease, and what are those things? I'm going to give you some simple explanation. So when you get older, it's a process. Of course, for the brain functions as you get older, of course, it's great to function normally. But in terms of memory, if you have issues, maybe initially there is something called mild cognitive impairment, MCI in acronym. So what is that? Actually, it means that maybe your memory is not as good, but your daily functions are still intact. No defects. But if your daily functions are impaired, and in that case, you may be suffering from dementia. Dementia is actually a very general term. There are many forms of dementia. I'm going to explain some of the common dementia cases. So there's this MCI mild cognitive impairment. So we know that this is one of the causes for one of the risk factors that cause dementia, but we cannot be sure that if you have MCI, then for 100% you will have dementia. Well, we haven't got to that point yet. However, we know that if you have MCI, every year there are changes. There will be deterioration, and there'll be 10 to 15% deterioration. So for that, we want to know early, like Dr. Ma said, and I agree very much that seek help early, because if you can have an early treatment, you can have comprehensive assessment, you talk to your family doctor, you talk to a specialist like geriatrician, and if you suspect that you have MCI, and we can do some assessments where some standard tests, we call it MMSE, MOC, MOCA, something like that. So these are very basic standard tests. So when you see a family doctor or a specialist, you can discuss with them and see if you can have an assessment. Now, as far as dementia, actually, there are many types of dementia. The most common type is we call Alzheimer's disease or Asperger's syndrome. Now, other than Alzheimer's disease, there is also the cardiovascular disease. There's also the Asperger combined with cardiovascular diseases. These are three common situations that take up about 80% of people with dementia cases. In other words, 80% of those who suffer from dementia, maybe they have either Alzheimer's disease or Asperger's syndrome or cardiovascular disease. Now, the other 20% will be just, you have to consult specialists to have a assessment. Now, in terms of functional impairment, what's that all about? So we've heard that Dr. Ma has explained in detail, and I'm going to explain some more. So during the initial stage of a patient, some complex functions may be affected. For example, decision-making capacity, financial management, driving ability, cooking meals, and using a phone, or using a microphone, or when you buy a new washer, you don't know how to use it. So in terms of basic daily functions, if that's also been affected, for example, changing your clothes, going to the bathroom, taking a bath, if you have difficulties even with walking, if you have problem even feeding yourself, that's more serious then. We say that, well, when you have a sick, seek help early and get a proper diagnosis. And those who take care of the patients that also has a serious impact on them. So those who have suffered from dementia we have to know that we don't not only have to treat the patient themselves, also the caregivers around them, they also need our support. Now, actually, when we talk about dementia, other than poor memory, what other issues are there? So common situations, for example, you cannot recognize your relatives, your family, or friends you haven't seen a long time, or you misidentify your siblings or even your spouse. Also, your focus, your concentration has difficulty. You cannot articulate what you want to say. You keep repeating yourself. And I'll give you some a boost of confidence, So we say that even if you're repetitive, it doesn't mean that you suffer from dementia, so don't worry about it. What about some strange behaviors? For example, overly anxious, extremely anxious, to the point where it affects daily functions. If you keep doing the same thing all the time, or your personality has changed, if you have been a very cool, calm, and collected person, now you become an aggressive person, or your family notice that, oh dear, this senior at home, he used to be a very mild person, now he swears a lot and he's very violent. So there's personality changes. And also if he gets lost, or if he loiters around, or he forgets to turn off the stove, forgets to turn off the faucet. So these are not normal situations, right? Of course, there's also hallucinations, hearing things that are not there, or incontinence, or poor appetite, or problem with swallowing. So you will have to consult doctors for those. Now, very simply, I am going to discuss with you a brain scan of someone who has dementia. This is not an MRI, actually. This is actually a brain scan. Now, this is brain scan. You can see that in this dementia case, the black areas shouldn't be that big black area. There should be some space. And in the middle of the brain, there are some gray white points that shows that this person has suffered a stroke before. So other than seeking early help, what does it mean? So seeking early help means that you have to consult your family doctor, or your specialist or geriatrician, or you have to follow up with the patient's medical history to give an overall assessment. And the most important thing is about functions. Are there impairments in the daily functions? So if there are, maybe it's mild MCI, mild cognitive impairment. If the impairment, the functional is serious, then it's dementia. So the way to deal with that, there are many ways. You don't have to use medications. There are ways to cope with that. You can use a notepad or use colors, post-it notes. Or if you're worried that the patient is prone to getting lost, and then you can use GPS, and maybe you put that on your smartphone, download that on your smartphone to help those who are prone to getting lost. Now, the most important thing is to support the patient and to support the family. You have to do that early. So you can consult the Alzheimer's Society of British Columbia, or you can ask for help from them. And here in BC, we are lucky to have Alzheimer's Society in British Columbia. They offer services in Chinese and free services. You can call them from all over British Columbia and speak in Mandarin or Cantonese. And if the situation gets to the point where it creates a lot of stress to the family, so we think that would be very helpful. I know that today's talk and tomorrow's talks, you will hear that early intervention for patients to plan ahead especially special arrangements. Those things will be important as well. Now, during the pandemic, it's been almost 2 years now, and for dementia patients, there are many things that we can help them with. So this is there's the website from the Faculty of Medicine at UBC, and there are many articles which we can share with you all today. And the most important thing is, if every year you have not been vaccinated, you have not taken your flu shot every year, so it's time to take your flu shot because it reduces the chances of having to go to hospital and die, and doing more exercises. Even if you don't go outdoors, you can do exercises at home at appropriate times, because daily schedule, daily routines, fixed daily routines is important. Also, social activities, using different kinds of social media platforms. Yes, physical health is important. Mental health is also important. And of course, during the pandemic, we have ways in Canada to get vaccinations, and it's very important to get vaccinated. Most of my friends, most of the elderly people have had their 2 shots, and here in BC, we are getting the 3rd shot done now, so get your shots early. Other than that, we know that the music is also helpful, very, very helpful to dementia patients. Music therapy, for example, there are articles from the School of Medicine of UBC that tells you that music helps in terms of the moods of dementia patients. So whether you're singing or dancing or just or playing playing musical instruments, it doesn't matter. Now, as far as medications are concerned, here in Canada, in North America and around the world, there are many types of medications to reduce the progress, the deterioration of dementia. There are 4 kinds of medications here. There you can see those 4 types. Actually, those 4 types after the assessment, your family doctor, your specialist can make the decision with you whether to use medications to treat you. So here I will tell you that recently there is a very hot topic in the United States of America. There's a new medicine called aducanumab, which is a immunovaccine, antibody, and so it's a starch type, a protein type of medication, and this antibody, monoclonal body, will it actually help the early dementia patients to reduce the progress of their the condition. We still await evidence to prove that, but in the United States, recently they have temporarily, FDA has approved temporarily this medications, but there are also research being done in other countries. We know that in terms of medications, there are always some new discoveries, new breakthroughs, and of course, still too early to make conclusions to tell you which medications are useful and which are not at this point in time. As far as the patients, caregivers, and family, what do they have to pay attention to? Well, as a geriatrician, I know that to treat dementia patients, you have also to care for their patients, the patients' families and their caregivers, because it could be very stressful. How do you help their caregivers and family to de-stress them? This is also very important. In September, I wrote an article. Which was published in the Province, the newspaper. So if you're interested, you can look that up. And that article, there's also a Chinese translation, which you can see at the Alzheimer's Society of BC. And also there's information about the dementia, actually success some years ago, they published a book about the dementia, which you can also look up. And if you're interested in some seminars, TED Talks, I've done some TED Talks about how to help the elderly people with dementia to stay at home. So I thank you for your support, and I hope that it has been helpful. Thank you, Dr. Wong. Now, I want to thank all the speakers of today, and there are also many community partners who have supported our activities. And I want to thank the Ministry of Health of BCA Patients as Partners initiative, this project to support our work. And our community as partners, there's so many partners: Mosaic, Canadian Mental Health Association, Alzheimer's Society of British Columbia, Diversity Self-Management, South Vancouver Neighborhood House, Family Caregivers of British Columbia, and RCMRG. So, and also media partners who sponsor and support our activities so that we can have such a huge audience to join us in today's forum. Thank you very much. And finally, we thank our exhibitors, our health exhibitors. Right. First of all, I want to thank the health exhibitors. What I want to tell everyone is that there's going to be a month-long exhibition there. For example, our Alzheimer's Society of British Columbia and the Canadian Mental Health Association, as well as Success and South Vancouver Neighborhood House and Richmond Gives, Family Caregivers of British Columbia, and Diversity, and our own iCON network will also display information there for 1 whole month. We also want to thank Richmond Gives, who in our community center has a viewing party, and also want to thank Cathay for hosting a viewing party. For now, that's all for today, and I will thank you in English. So remember, tomorrow, 2 p.m., we are going to continue our talks on different topics. And tomorrow, we're going to talk about nutritional knowledge on dementia, our nutritionist, Jojo, and the mental health of patients as well as their caregivers, Dr. Tigerson Young, I'm sure you know him well, and also safety and long-term care. And we have Wendy to host this talk. And you're all familiar with her. She's a registered occupational therapist. So I hope that everyone will join us again at 2 p.m. tomorrow on air, and we will share a lot more information with you. So hopefully we'll see you again tomorrow. That's it for now. See you tomorrow.